at NTV.
Hello, we are very grateful that you're still with us here on Morning at NTV and for choosing your number one broadcaster for quality programming. We are taking note of the fact that national IDs may be blocking access to social protection in this country. Now, what does that mean? Many of us have heard of what is known as SAGE, a program that sees the government roll out a monthly stipend to older persons. This is designed to help them get along life because it is understood and statistically so that they are not gainfully employed and may not be able to meet the basic needs of everyday life, and that government should be able to provide that monthly stipend. However, determination of their age is still an issue and a bone of contention. Many apparently are saying they are, for example, 65 when actually they could be 77. How does the government move to ensure that such persons are actually identified effectively to ensure that the entire program or the measures that are being rolled out are effective in ensuring a social protection? Well, those are matters that are complex and sometimes gray. We have the communications manager at the Parliamentary Forum on Social Protection, Gloria Nakajui, joining us this morning to help us wade our way through these very unclear waters, so to speak. Not muddy today. Good morning.
Good morning.
Allow you, first and foremost, to give us a preamble about the Parliamentary Forum on Social Protection, its mandate, and exactly where we are in terms of conduct of that mandate.
Okay, thank you so much, and thank you for having me. So the Parliamentary Forum on Social Protection, what we do really is to do advocacy in Parliament on issues around social protection, and specifically social protection legislation and resource allocation, because that is really the mandate of Parliament. So what we do basically is to ensure, to track the different social protection interventions in the country and make sure that they are being effectively implemented, but also appropriate resources are allocated to the same. Yes.
Okay, and in this particular light, there is concern that perhaps the rollout of social protection measures and programs by the government could be facing a little bit of trouble as a result of statistical imbalances. The other day, or just about a few months ago, we saw some civil servants agitating to edit information on those critical documents, including the national ID. Many of them wanted to be younger than they actually are. Now, for these programs, including SAGE, we already have older persons who have stated they are younger, and it's a bit of a problem. Take us through exactly what this is and how you are maneuvering your way in ensuring that it's rectified.
Yeah, thank you so much. And I think what we need to appreciate is social protection. At the core of social protection is to ensure that you protect people from poverty, falling deeper into poverty, or protecting them from vulnerability.
That's right.
So we are looking at people that are already vulnerable or that are at risk of getting falling down into poverty. So what happens is a lot of social protection interventions, the Senior Citizens Grant, as you've ably highlighted, and of course other interventions. We've been working quite closely with the World Food Programme on the child-sensitive social protection program that is being implemented in West Nile. So we've done an assessment and realized that, for instance, for the Senior Citizens Grant, the people that were targeted under the national rollout, because the program is now being implemented nationally. So they targeted about 200,500 people, older persons. But out of that, 13% do not have national IDs, or if they have national IDs, they have errors. So their ages were misstated, or even their names. So they get targeted for the program, but when it gets to enrollment, because the program is asking for, you have to present a national ID, but also you have to be 80 years and above. So if your national ID is reading 65 or 70, you're left out. You've actually seen cases where you have two people, maybe a parent and maybe a child. Okay, older people. But the child is receiving the grant, the parent is not. So what explains that? Definitely there is an error. And when it comes to the child-sensitive social protection program in West Nile, about 41% of the people that are targeted for that program do not have national IDs. Okay, this one targets lactating mothers and also children below 2 years and pregnant mothers. So for them, they give them some money to support them in nutrition, accessing nutrition, but also supporting them in daily basics, basically to make sure that at that stage in life, children are protected. Yeah. So a national ID is a critical tool when it comes to social protection targeting and identification. It is a very, very important tool. Yeah. But if it's going to stand in the way of delivering these interventions that would ideally be intended to help people out of vulnerability, then you are effectively making these people more vulnerable. So what are we asking?
Exactly, I was just going to ask.
So what are we asking? We've been working quite closely with NIRA, and our key ask, but also from government, is to increase funding to NIRA. We want NIRA to take the service to the people and not the people to come chasing NIRA. Because right now, NIRA has a staff to population ratio of about 1 to 50,000. I mean, how are they expected to deliver? So they are not, that is why you'll apply for a national ID and it takes 6 months or 3 years. Okay, well. And then also, when it comes to the cost, you're dealing with older persons. They're already poor. But then if they have to replace their national ID in case they lost it, they need to pay 50,000. And of course, as you heard, they're proposing to increase that to 200,000. I mean, where are these people going to get that money to pay? And the other issue is when it comes to correcting errors. Yeah. If you need to correct an error, you're supposed to present documents such as a statutory declaration that is registered by the Uganda Registration Services Bureau, or you're supposed to present baptism card, academic documents. Come on.
75-year-old,
75-year-old, 85-year-old,
for a certificate.
Yes.
Probably
do they even know where URSB is, or how are they able to access legal services to be able to have a statutory declaration?
So essentially, let me just hammer this down and to bring our viewers up to speed with what could be an ongoing constraint to accessing some of this type of money by the elderly persons. People have been unable to get national IDs because of the, overly laborious nature of accessing that. And then it means there's a lot of money that is not reaching those who are supposed to get it.
Yes.
And that is exactly where the point of contention is. You need to be able to either put NIRA on the spot,
yes,
so that, or government does something pretty quickly to ensure that that is achieved.
Because what we need is actually for areas or people that need to be reached by these social protection interventions, we need like kind of affirmative action. For older persons 80 years and above, then let us waive that 50,000 that they have to pay. And then when it comes to access, we can provide them like targeted registration points whereby the NIRA can, for instance, set up in their localities. For instance, if government goes out to pay out older persons, we can have a NIRA service point at that same place so that the people that come and they have issues with their IDs, they're able to get that service from there. So people know, okay, when the senior citizens grant team is coming to pay, we can also go and access NIRA services. So at least with that, they're getting like, that comes in as a complimentary service. Yeah, so, and also the other issue is we want government to enhance birth registrations. Because when you register a child right now, they get a NIN. Okay, they don't get the ID, but they get a NIN.
That's right.
So that when they get to the eligible age, that is 16, they can get, it is easy to get your ID because you already have your NIN. But now we're keeping them here, waiting them to that time, and to become again more...
the logistical challenge.
Yes, so why not target them at the health facility? Actually, UNICEF is supporting in some areas these interventions at the health facility where they support the registrations. So we are looking at that and saying, saying, okay, if government can benchmark on that, NIRA can also work closely with these health facilities so that every child that is born is registered. And you know, sometimes you register and you only get the short birth, the hospital, okay, the birth notification. But people, but also there's also an issue of awareness. People do not go through the entire process to get the actual birth certificate.
Allow me ask the question. You spoke about benchmarking. The Parliamentary Forum on Social Protection, I think, has the ability to research, but also access information on other social protection arrangements across the globe. Where is this particular rollout or initiative working best that we can benchmark?
A number of countries.
Away from the Western. I need countries that more like have our own challenges but have been able to overcome them.
A number of countries,
Africa?
Kenya. Kenya is doing very, very well when it comes to their targeting. And it still comes to ensuring that these glitches in the national IDs are dealt with.
That's right.
So because if you ensure that your people are captured in the system, then you're able to know, okay, who is this, who deserves this particular intervention, because we don't have universal interventions, so you basically need to target. But if you do not have data, so the issue is on data. If you do not have data, then it becomes a very big challenge. So, but Kenya is doing quite well, and that's a place that we can actually benchmark.
Earlier, you spoke about the fact that 13% are not being reached, and there was information inconsistencies. For example, an elderly person says they are 65, but they look 74.
They say they are 74, but the ID reads 65.
Okay, yeah, sure, no doubt. I had completely flipped that. Now, in that case, who determines that they're actually older? By simply looking at somebody and saying, no, it's not, you're older than you actually say? Is that how it works? No,
so what happened at the initial registration, well, people didn't even really appreciate this thing. So you go to a community, a registration point. You remember we had to fill in all those very extensive forms, and so these people, a lot of them, many of them are not literate. So they will ask maybe a grandchild or someone nearby, okay, help me fill this. So they fill in, but also even at the service points, they would ask them, okay, how old are you? They're like, well, maybe they start looking at events that happen. So maybe they start estimating. You know, so this person registering, the person registering will be like, okay, I think maybe you're 65. So now government comes up with an intervention that says, okay, 80 years and above, we are targeting you. And you look at your ID like, my colleagues, my peers are receiving this money. How am I not? So they tell you, okay, but your ID reads 60. You're like, no, but I was born in the same, those guys are my peers. But I mean, your ID says otherwise. So those were usually the challenges. You're dealing with an illiterate population, but also there are no efforts to support them to provide accurate information. So that is how data got mixed up. All right, allow us broaden this debate away from the elderly to the general subject matter of social protection in this country. And of course, it kind of entails just about the whole process. For the children out there, the vulnerability levels are increasing across the country, where, for example, birth certificates are unable to come in on time, and that means some of the children cannot be registered on beneficiary initiatives. For example, National Social Security Fund itself is a social protection measure. Now, what is the forum doing to ensure that some of these aspects are, first of all, improved away from the mainstream that we know about, because these ones could be getting less attention as compared to the elderly persons? Yeah, actually, that's a very important question. What we are looking at as a forum, our strategy is to have kind of a life cycle approach to social protection advocacy. So you're looking from childhood until at the later stage in time. So childhood, the youth, working population, and then older persons. And our key concern for us, what we are saying is, because right now, social protection coverage in the country is at about 6.2%. Those are people that have at least
6.
Yes, at least one social protection cover, meaning that at any one point, if something happens, then a lot of us are going to fall back into poverty or fall into poverty or I mean, we saw this during COVID. The people that we thought were well off, before you know it, and they always say the corporate class is one paycheck away from poverty. So, but what is there to ensure that everyone at each stage of the life cycle, they have some guarantee? Yeah. We have an issue with health insurance. We have a very high out-of-pocket expenditure in this country. So for us, what we are looking at is to ensure that we expedite the National Health Insurance Scheme bill. Because at least there, you know, there's some cover. People do not have, we don't have to rush to go out for car washes to fundraise. Yes.
You go to old boys and girls.
Yes. Yeah. So those are the things. And then also we've been working quite closely with the Ministry of Gender, Labour and Social Development that is trying to develop a national social protection strategy to ensure that we highlight key indicators, social protection indicators that we want for each category of the population. So at the end of the day, we're going to have that costed. And when that is costed, it's going to give us like a tool, an advocacy tool, to ensure that we have every Ugandan, because the ILO talks about having social security guarantees, the social protection flow. As a country, we need to come to that point where we say, okay, this is the minimum level of suffering that we can allow for our people. We don't want our people to be living, to be a statistic in the people that are living below $1 a day. So we have to agree on, some of these things are principles.
That's right.
You have to have a principle where people agree, shared principles, not that people want to, well, me, when I'm okay, I don't care what happens to the person next door. Those are things we need to agree on as a country and say, no, we're going to make sure that none of us, if it is development, we develop together. If it is accessing quality health, we all access quality health care.
2 follow-up questions on that issue. The bill, how far are we in terms of pushing? Because I do know that many times effort is stifled by the fact that there isn't a particular lobby group that supports an initiative, and there is a lobby group that supports another initiative that takes the day. I don't know whether the social protection activists or the backers or proponents are not doing a good job in terms of creating the kind of euphoria around it. Just take us up to speed where that is. But also, you spoke about a national social protection strategy.
Yes.
One thing I must be very emphatic about is that some of these blueprints are already available. And it's mostly a case of looking at them and either fine-tuning, crossing some T's and dotting some I's,
or making them actionable.
Roll them out. Why should we look at a comprehensive design of a new blueprint when we have what we can fine-tune?
Thank you. So on the National Health Insurance Scheme bill, I think that really hit a bit of a snag, and we definitely have to go back and push because the president sent it back. So because it had been approved by Parliament and it was waiting for ascension from the head of state, but he sent it back without signing and with no comments. So, but what that means is you have to go back to the drawing board and basically come up with new arguments or. But discussions have started already. The Ministry of Health is leading on this, and as a social protection community, there have been a lot of discussions on the bill, and we're trying to strategize and see how best can we reinvigorate or bring this back to the discussion table. All
right, and then finally on that strategy.
Yes, on the national strategy, because what we've been having is a national social protection policy. Yes, but the policy does not speak to the finer details of what exactly you want to implement, because the policy will tell you, okay, we're going to have social security for everyone.
That's right.
But the strategy will tell you, under social security, what do we want for under NSSF, that is for the formal, but of course now it was expanded to include the informal, but also specific strategies that can tap into the informal sector to ensure that these can be able to be covered under Social Security. And then also we will have clear interventions for children, clear interventions for the youth, unemployment cover, and then we will have clear interventions for the working age population. Then we will also have clear interventions for older persons. And the idea is to make sure that we do not have a population that is going to be, at the end of the day, eligible for the senior citizens grant. We want to start early to make sure that people are prepared enough so that they can be able to contribute for their own social security at the end of the day, and they're able to live a dignified life at the end of the day.
Gloria Nakajubi, thanks for the insight and perspectives on social protection that you have shared with us this morning. That is Gloria Nakajubi, Communications Manager at the Parliamentary Forum on Social Protection. The Morning at NTV does continue. The discussion is now going to slide into something that you do not want to miss, not even for a second: mental health. Now, most of us present with stresses and then we think it is a passing fad. Absolutely not. That is what people grapple with, and many who can't come to terms with the challenges that they face on a daily basis often slide into mental health problems. You can understand the dynamics at play and of course how you can avoid that. Priscilla Regina Naloga will be coming up with that discussion.